name's Derek, and I'm here with Dr. Aaron LeBauer. Thanks so much for meeting up with me today.
Oh yeah, you're welcome, absolutely.
I want to go through a couple quick questions with you. I want to interview you about physical therapy, what you do here at LeBauer PT. But first, can you tell me a little bit about your background and how you came to be the owner of LeBauer Physical Therapy?
Yeah, that's a great question. I will give you the short story because it was a long road. When I got out of college, I moved out to California and was interested in racing bikes, but I didn't have a job that would support that. And I had been interested in massage therapy for a while because when I was racing bikes, there was one year where my legs were hurting a lot, and my mom sent me for a massage, and it felt so much better. So I eventually went to massage therapy school, which allowed me to pursue my dreams and passions in racing bikes. And then after doing massage for 6 years, I had been treating a bunch of patients who had already been to PT, chiropractic, physician surgeons, other massage therapists, and were in chronic pain and still hurt, and I was able to help them. And I realized that I needed more knowledge and education, so I went to PT school when I was 34. And after I graduated PT school, I realized that I wasn't going to be able to get a job treating patients the way I felt like they needed to be treated. And I wasn't going to be able to do that within the current model of insurance reimbursement, etc. So I decided to start my own business that provides physical therapy without insurance companies dictating how we treat patients.
Awesome. So you said something kind of important there. That you said that you didn't think you'd be able to treat patients the way that they needed. So what is different about LeBauer Physical Therapy that you're able to treat patients the way they need?
Mm-hmm. So in a traditional setting, I can also say this in a traditional setting, when I was a student, there were places where I was limited in how I could treat patients, what I could treat patients, how many patients I could see, or how long I could see them, because insurance would deny reimbursement based on what we were doing. So for instance, if I did 45 minutes of hands-on care, we would get denied, 2 units. And so what it did was that took the business and made them say, okay, you can only do this and you can do that. You don't do anything that we're not going to get reimbursed. So what makes us different is that in our business, we contract directly with our patients. So our patients and us at LeBauer Physical Therapy, we have a direct relationship, so we work for our patients. We decide what's best for patients, and we're able to provide the amount of hands-on care or therapeutic exercise or frequency of visits or duration of visits that's best for the patients.
Gotcha. Perfect. So I guess that kind of leads me into what should you come to a physical therapist for?
Now, that's a great question. I think a lot of people have a misunderstanding about physical therapy because as a profession we've done a poor job of explaining what we do or sharing what we do. Physical therapy is something that can help almost anyone. You don't have to be in pain and you don't have to be injured to benefit from physical therapy. However, we do treat a lot of people who are hurting or have been injured or are currently injured. So an acute injury, not a broken bone or something that's bleeding, but something where you've injured your back or your knee or your neck within the last few days. The sooner you get physical therapy, the sooner you feel better. We also treat people who have been in pain for a long time or have tried other things. And we help people perform better, because even if you're not hurting, it may be that you can only deadlift 300 pounds, and once you get past 325, your hip starts to hurt. Well, that might not even be your hip, it might be your back that's the problem, and we can uncover those issues to help people perform better, achieve personal records in their activities, or even just live life to their fullest without their physical body limiting them, or understanding what the limit is so that you can maximize your time in your workouts. So we can give you exercises to do before and after your workouts that are going to help you improve the overall quality of your movement in life. And that being said, we help a lot of people who are active and healthy avoid pain medications, injections, and surgery.
Okay, perfect. So I guess what does because it seems like you talked a little bit about your LeBauer PT and some other places and the differences, but what does a typical treatment, when a patient comes in and sees you or sees LeBauer physical therapy, what does a typical treatment look like?
So in our clinic, what we do is we'll talk to our patients on the phone first. Before you even come in, we're going to have a conversation with you about what's important to you, what your goals are, what you're struggling with, so that we can understand truly what we need to achieve and what success looks like. And then you come in and you visit with us in the clinic. In the first visit, we're going to talk again and just make sure we're really clear on where the problem is and what you want. And then we're going to take you through a movement assessment, a hands-on assessment, so we know where the movement problem is and where you hurt, where your symptoms are coming from. And then our goal is kind of 3 phases. It's phase 1 to reduce the problem that you're having, whether it's pain or some kind of symptom, tingling, numbness thing, or whatever else you're struggling with, reduce that, then find out where the true cause is. So we look at the whole body. And then we work on making you stronger or more resilient to the problem happening again. And we spend about 45 minutes in each session. It's one-on-one in a nice, quiet, private treatment room where we will do hands-on work, we will do corrective exercise, and we will get feedback from our patients based on what they're feeling and what we feel, and we'll do a treatment and then we'll retest and see how it goes. And every visit, we're always doing a little reassessment and little mini reevaluation to see what progress have we made and what progress do we need to continue making. And we typically see patients once a week. However, we will see them more often or less often based on what they need, what their goals are, and how long we have to achieve them.
Perfect. Okay. Lastly, can you just talk a little bit about what we have here? Looks like you wrote a book. If you wouldn't mind going over that and maybe tell the people where they can find a way to get your book.
Right. So I wrote a book. It's called The 7 Secrets to Heal Your Back and Stay Pain-Free Without Ever Needing Pain Medications, Injections, or Surgery Again. And I wrote the book because the number one problem people come to see me for is back pain. Or they've got a hip issue, which is really a back issue, or they've got a back issue, it's a hip issue, or it's something involving their back, because back pain is the number one reason most people in the United States miss work. Just back pain alone causes, hundreds of millions of dollars of loss of income of, businesses and individuals, and it's one of the number one reasons people are taking opioid pain medications is back pain. So I wrote the book to help educate people on some steps that they can take to resolve the problem themselves or start making progress towards it and understanding really what is happening. And in there I go over some gentle yoga exercises, some tips on what to do every day, and then how to understand if you need more help. If you want to get this book, you can go to our website. It's LeBauerPT.com, and then on that page there's a link where you can download our book for free, or if you'd like, you can come into our clinic and we can give you a printed copy as well.
And then, so I peeked at your website before, and I did see a couple of other, looks like buttons on there, a talk to a PT button and a total body diagnostic. Can you talk a little bit about what those are?
Yeah, so what we want to do is give people an opportunity to speak with us or get some information from us before committing to a plan of care, before committing to working with us. It's kind of like when you go to the Apple store 3 or 4 times before you buy the new iPhone. We want to give people an opportunity to come in and get to know us. So we've got a couple different options. You can go to our website and talk to a PT first. Is if you want to speak with one of our physical therapists, one of our back pain specialists and doctors of physical therapy, we can make that happen for you. We can set up a time to talk to them, and you can share about what's going on, what problems it's causing you, and then even on the phone you can get some information and strategy about what to do next. We also have an opportunity to get one of our free total body diagnostic exams. This is a free 20-minute visit where we'll talk to you about what's going on and take you through a full total body movement exam. So we will have a really good idea about what's going on and how we can help and how we can fix the problem. And when you come in for that kind of visit or talk to us on the phone, we can give you a roadmap for how we can work together to solve the problems that you're having.
I don't think I've met any other doctor that's willing to give a free visit.
Right. I know, right? So we also, when you come in, we want to know who you are, your name, and a whole bunch more information about you, more than just your insurance and your birth date. And so a lot of people are taken off by that, taken aback by that. They're like, oh, you want to talk to me about this? So when you call us, just know it's something that we want to get to know you personally and bring you in as part of our family so that we can continue to help you even through the current episode and maintain your active and mobile life for the rest of your time, so that we can keep you in our family and keep you healthy and keep you experiencing life the way it's meant to be.
Yeah, I think you said something important there, is that, so do you look, am I correct in saying this, you look at your patients as not just now, but you want them to have an answer for the rest of their lives when they feel pain?
Exactly, and that's one of the reasons we offer some wellness programs. We offer performance assessments, ongoing wellness memberships, as well as massage therapy and private yoga.
Awesome. Okay. All right. Thank you so much for your time,
You're welcome.
Aaron.
You're welcome. Pleasure being here.
We'll see you soon.
All right.